This is therapy where high estrogen is used to forestall growth in young children. It is usually used in children from 3 to 6 years old. The history of high estrogen use began in the 1940s to treat acromegaly and prevent those from acromegaly to have normal stature. In the 1950s to 1970s, it was used in women who were seen as abnormally tall to have normal stature, and now in the turn of the century, it is nearly obsolete. Now, for growth attenuation therapy, one of the first patients to undergo this was termed Ashley X. This patient was unable to walk, sit, or move her head without assistance. She also was mute and was able to have some facial expressions, and she was fed through a gastrostomy tube. Due to the high dosage of estrogen that she received through growth attenuation therapy, she needed to undergo a hysterectomy to prevent painful menses, as well as uterine bleeding, and she also needed to undergo a surgical procedure to remove her breast nodules to prevent overgrowth of breast tissue because of the high estrogen. And due to this therapy, she also needs to be continually monitored throughout its process.
Hi, Angie.
Hey, nice to see you.
Too, Sam. So since the last visit, has there been any problems at home, transfers, anything like that?
Actually, yes, I've been having a lot of difficulties with Sam lately. Like this morning, I wasn't able to change his shirt, and it was getting to the point where it was very time consuming and we were going to be late for our appointment. Also, since my husband is at work most of the time, I'm home alone with Sam, and I have lots of difficulties transferring him from the wheelchair to his bed, from the wheelchair to the bathroom, and I just don't know what to do anymore. It's very stressful, it's very time consuming. I don't know what to do anymore.
So would you like me to teach you some transfers, or do you want me to prescribe some Hoyer lift to see if their insurance will pay for it?
I think that'll be nice, but I still don't think that me personally, myself, I would be able to transfer Sam. And my friend, I also have another child, my other son, he's 3 years old right now. He also has cerebral palsy, and my friend recommended something called growth attenuation therapy. Have you heard about that?
I have heard of growth attenuation therapy. The bad parts of it is that with high doses of estrogen, there are many side effects, so he will have to be monitored constantly if you do choose to go through therapy. Though many parents, when they do choose that, they do find it a lot easier to handle their children and take care of them. Now, I suggest you see a developmental specialist beforehand, just to make sure you know everything that could go wrong with the therapy, and then look at your options and proceed from there.
I've been having a lot of trouble with Sam, that I've even been considering to place him in an institution, and I really don't want to go that route. Is there anything else that I can do?
I mean, at this moment, the most you could do is have OT interventions as well as PT interventions, where they will help you set up your home, so make it easier for you to handle Sam. But yeah, that's your alternative to growth attenuation therapy.
Okay, so do you think you could show me some easier ways for some transfers?
Sure.
Based on your interpretation of current laws, do you think growth attenuation is legal?
Based on the existing laws, I think it is legal because, first of all, informed consent is a very big part of ethics and legality. In the case of Ashley X and many other cases, many of these patients are severely disabled in their mental capacity, which most people would not consider them eligible for informed consent. And in many of these cases, these are also children being treated. So there is something called permissive consent, where the guardian is given the authority to make those decisions. So in these cases, you have mentally disabled children who are not able to receive informed consent, and so the parents are responsible for making the decisions. In Child Protective Services, they have on their website, they outline the definitions of abuse and maltreatment as outlined by the state of New York. And abuse is identified as creating harm for that child or inflicting a chance of risk for future injury. In the case of Ashley X, I think that not giving her in many of the other cases, not giving her this therapy could lead to damages and even more risk if people are unable to take care of her properly. And that leads to maltreatment, which is not taking care of your child properly or giving adequate care. Now, if your child is growing and you are getting older and unable to take care of them, then you are endangering them and you are running the risks of improperly taking care of them, which would fall under maltreatment for a child. So I think this is legal because the parents have the responsibility to take care of their child, and to not do this could endanger them.
So the Rehabilitation Act of 1973, Section 504, is a civil rights law that prohibits discrimination against individuals with a disability based on their disability. And the Americans with Disability Act of 1990, also known as ADA, is a federal civil rights law that prohibits discrimination against individuals with disabilities in everyday activities, including medical services. Now, the reason I claim discrimination is because the parents are suggesting that the child isn't going to have a life that is going to be worth having because of their disability if they don't get this type of therapy. Now, if we make the postulation that a child who isn't born normal as another person should be subjected to a surgery to change their stature to fit everyone else's comfort level, then what precedent is that setting for society that we then could do away with the child's rights and change them to fit whatever we deem to be necessary, instead of having society adapt to that child and society being able to help that child work in society as a normal individual. Now, in Title II and Title III of ADA, as well as Section 504 that I previously mentioned, that it requires medical providers to provide individuals with disabilities full and equal access to their healthcare services and facilities. Now, if these children are unable to give consent, mainly because yes, they are young, but they also have mental disabilities, then is that service then being equal if the parents are making that decision based on the child, based for the child on preconceived notions, which in definition is discrimination. Now, also, if there are also reasonable modifications that are allowed for policies and procedures, but these modifications can't alter the nature of the service. Now, the nature of the service for a medical care provider is to provide healthcare to the individual for that individual to be in better health, not for anybody else outside of that. The patient is the primary concern. So if the care is for the parent to have more comfort, then that is fundamentally altering it.
From an ethical standpoint, do you think that there are any arguments that can be made in favor or against growth attenuation therapy?
The ethical issue with growth attenuation therapy begins with the fact that it's not actually a treatment, because it doesn't actually cure or treat any illness that the child is presently having. Now, if it's not actually a treatment, should we be implementing this? Because the treatment only decreases the height of the child to better fit the parents' efforts in taking care of that child. Now, there's no research to indicate that the child will have a better quality of life if their stature is lower than it would be normally without the therapy, and the therapy also causes many side effects in the child, such as thrombosis, mild hypertension, ovarian cysts, and excess prolactin in the blood. These are all side effects of estrogen treatment, which off-label estrogen dosage isn't regulated by the FDA. These regulations allow care providers to safely administer these therapies for the patients, and without this regulation, how can we ensure that the patients will have the highest level of care? The care provider has a duty to not cause harm and promote good in the patient, and if they choose to promote this therapy without proper research to ensure that the provider can inform the patient of the harm that it may cause them, both in the short term and long term, then is that provider failing to accomplish their duty? I think they are.
From an ethical aspect, parental choice is a private matter and usually made after evaluating risks, benefits, and alternatives of a treatment. Although this decision may seem selfish on the parent's behalf, this has positive outcomes for both parent and child. It benefits the child because they will be moved more frequently, which equals more stimulation, fewer medical complications, and more social interaction. Also, more physical and direct contact will be implemented, and children will be involved in more family vacations and outings. It also reduces the chances of abandonment because the child will be less vulnerable to be placed in some institutions because of the unwillingness of the parents to take care of them. Some might say this treatment compromises the child's dignity, but the word dignity usually refers to terms such as autonomy and embarrassment, which are useless concepts to these children because they lack the mental capacity. All technologies and treatments entail risks and may be misused, and some argue the risk of this treatment outweighs the benefits, but it actually helps reduce some long-term side effects that may come with these disabilities, such as those in cerebral palsy, such as poor wheelchair seating, which can result in increased back pain, weight gain, which can result in joint pain, and some alternatives that parents might try to implement will be inappropriate orthopedic surgery. So in my opinion, this is ethical and in the parent's choice to make for the child.
Physical therapy for disabled children is beneficial without having to use hormone therapy. Physical therapy increases the child's strength, endurance, balance, circulation, and energy. All of these can benefit the parents at home because when the child has increased muscles and endurance, it puts less weight on the parents. Physical therapy also includes reducing pain, swelling, and increasing the child's mobility. Regular fitness at physical therapy decreases their chances of getting other diseases and increases their emotions. There's also group therapy and music therapy that encourages the child to keep going with the physical therapy. Physical therapists will teach the parents how to use a wheelchair, proper moving and lifting, transfers, which all make it easier for the parents at home without having to use hormone therapy.
Although after growth attenuation therapy, patients will still benefit from physical therapy, the need will decrease. Also, the need for assistive devices will also decrease, lifting huge financial burdens off of the entire family. For example, Hoyer lifts, which are used in daily transfers, will no longer be needed. This can benefit the family because Hoyer lifts can be extremely costly, ranging from $700 to $3,000. Some patients just don't have the financial funds for this or the space for this. Also, during physical therapy and home life, the need for more than one person assistance during transfers will also no longer be required due to the patient's smaller stature. Growth attenuation therapy not only makes the family's job much easier, but medical practitioners' job much easier as well. Analyzing the research you guys have done, what is your personal opinions on growth attenuation therapy?
To me, this type of therapy is not right. It does not sound humane to stop your child's growth just because they are disabled. It sounds like it does not benefit the child as much as the parents. It seems like they make it easier on their life so that they can take care of the child better. To me, it just feels like an inconvenience for them that their child is disabled and be more convenient to stop their growth. It's their duty as a parent to take care of their child no matter what without having to inject them with hormones. On another note, they're also removing some of their child's body parts in some cases. This is also unacceptable. You don't necessarily know that the body parts will not be beneficial in the long run. So it feels like they're just taking away the body parts they don't feel their child will need. Most parents with disabled children feel like they don't have any help. There needs to be more support groups and classes or lessons for them to take care of their child so that they don't resort to hormone therapy. Overall, I think that every child is entitled to grow. Don't you think that a child should grow up in a natural process of life?
Based on my opinion of the growth attenuation therapy, I think that it is okay in special cases for this therapy to be administered. This should be a case-by-case review. This shouldn't be just a blanket treatment for everyone. I think it should be monitored, but I think that the parents who are doing this, they're not just doing it to be lazy or make their lives more comfortable. It might seem that way, but most of these parents care very deeply for their children. Parents have this love for their kids that is very hard to explain, so for them to not want to do what's best for their kids is very hard to conceive. And in my opinion, I don't think that many parents would want to make their kid go through unnecessary pain just to make their lives better. Most of these cases, these parents are thoughtfully considering their options, and they think that being able to stay together as a family is very important. And that would happen because if you can take care of your children longer, you can personally take care of them by keeping them smaller so that you don't have to put them in a institution where someone else has to take care of them, where they're unfamiliar, they're this child who doesn't understand what's going on. You want them to be with you, and you don't want to have to take family trips to go see them. You want to do things as a family, stay together as a family. You don't want brothers or sisters like talking about their other brother that they only see once a week or maybe. So this is a way of keeping families together by keeping their child close to home. And I think that parents have the right to make that decision because they're ultimately trying to take care of their child the best they can, and I think we should leave that up to them to decide that.